Good evening, everybody. Happy Monday. I hope everyone had a wonderful weekend, safe weekend. If you went out, you wore facial coverings. Once again, not to protect you, but to protect your neighbor in case you're a carrier. We had a good day in the office today, and again, I hope everyone had a good day. Once again, a lot of great questions. The question that's popping up a lot on people's minds is about this new medication that the news has been talking about. Remdesivir is a medicine that is currently being studied. It is originally made by Gilead Pharmacies, which has produced that medicine in the past for other studies against other viruses, particularly against Ebola virus. It was found to be ineffective against Ebola. It was put on the shelf, and now it's being tested for SARS-CoV-2, or the virus that causes the current pandemic, COVID-19. SARS-CoV-2 is a virus. It actually is just to be clear, a single-stranded RNA virus. RNA just tells you what kind of genetic material is inside the virus. We did talk a little bit about the structure of the virus. We talked about how it has those protein points coming out of it that makes it look like a crown under a special type of microscope called an electron microscope. And because it looks like a crown, the word for crown in other languages is corona, so they called it the coronavirus. The important thing about that is it has those protein spikes, but remember, those protein spikes are all sitting on top of a layer of, the news calls it a lipid membrane. To be simple, we call it fat or grease. And we know what breaks down grease? Soap and water. So again, soap and water breaks down this virus. What's below that fatty layer is its genetic material, that is RNA. Okay. Remdesivir is an antiviral medicine that, if effective, will stop that virus from replicating. The way a virus grows and causes disease is by replicating itself. So the RNA is instructions for that virus to make itself and duplicate itself. If we have a medicine that stops that replicating process, we'll wipe out the disease. Because if the virus cannot replicate itself, it cannot cause disease, and it will die off. Remdesivir is a medication that hopefully can do that. However, it is only in clinical trials. Remdesivir is a medication that is not FDA approved for any treatment of any disease, not only in this country, but it is not used for any disease anywhere in this world. There are currently 4 trials going on, 2 of which are sponsored by this country. Number 1, 2,400 people are being studied who have severe disease and are hospitalized. 1,600 people are being studied in another study that have moderate disease, also hospitalized. If this medicine proves to work, this medicine, because it's used for moderate or severe disease patients, will be used for hospitalized patients most likely. It is an IV medication. It is not a pill. It's an IV medication that will be used in the hospital setting for people hospitalized with COVID-19. There are 40 medications being studied right now, one of which is Remdesivir. What we need is a pill that if you have mild symptoms, you'll be able to take a medication for a few days, get rid of the disease, and therefore never need to be hospitalized. And hopefully will never need to be on this medication. But if you were not able to get a medication, if you were not able to be cured from the disease and end up being hospitalized, the hope is this medicine will be available for you. The likely outcome with all these studies is that we probably won't end up with one medication to treat COVID-19. It's likely going to end up being a combination or a cocktail of medications to treat this. We don't know what that cocktail is yet because all those medicines are still being studied. The clinical trials are moving swiftly, a lot quicker than clinical trials usually move because of the severity of the illness, not only in this country, but around the world. We're hopeful, we're optimistic, but we're also realistic. We need to come up with a medication that will treat the disease and not harm the patient. So, to answer those questions about Remdesivir, not used for any disease right now, being studied for COVID-19. We're hopeful, but until those studies are done, we won't know if it could be used mainstream or can be widely used in this country and other countries. Once again, I appreciate all the questions. I hope everyone had a wonderful day. I look forward to talking to you again tomorrow. It's been my pleasure to do these lectures for you, and I look forward to continue doing this with you. Thank you. Good night, everybody.